Today we are looking at diabetes and hypertension. People with diabetes and high blood pressure are more at risk of having a heart attack or stroke. So it's important to know how to look after your blood pressure. If you have diabetics, you need your blood pressure checked by a healthcare professional at least once a year. Blood pressure hypertension is a condition that is seen in people with type 2 diabetes. It is believed that the following contribute to it: when you are obese, when you have a diet high in fat and sodium, when there is chronic inflammation in your system, and inactivity. If you have high blood pressure, it means that your blood is pumping through your heart and blood vessels with so much force. Over time, consistently, blood pressure causes the heart muscles to enlarge. If you have diabetics and high blood pressure, you need to constantly check it. If your blood pressure is high, called hypertension, you need treatment to bring it down. This is because it puts a strain on your blood vessels and can damage them. This can make it harder for blood to flow around the body and reach all the vital areas it needs to, like your heart. And you are more at risk of having a heart attack or stroke. It also puts you more at risk of developing all types of diabetic complications, such as having problems with your feet, your eyes, and your kidney. There are lots you can do yourself to help manage your blood pressure because your lifestyle has a direct impact. But lots of people also need to take medication to treat high blood pressure and reduce the risk complications. It is important to know that you might have high blood pressure and feel fine because there aren't usually any symptoms. But if you feel healthy, high blood pressure is damaging your blood vessels and you might need to get treatment. That's why you should regularly check your blood pressure. What is blood pressure? Blood pressure is the pressure your heart uses to push blood through your blood vessels and around your body. There are two numbers used to describe blood pressure, and it's millimeters of mercury. It's written like 130/80 millimeters mercury. And you hear your doctor say 130/80. The first number is the systolic pressure. The most amount of pressure your heart uses when beating to push the blood around your body. And the second number is the diastolic pressure. This is the least amount of pressure your heart uses when it relaxes between beats. So when your blood pressure is reading 130/80, it means that your systolic pressure is 130 milligram mercury and your diastolic pressure is 80 milligram mercury. What is the recommended blood pressure range for people with diabetes? It is important to keep your blood pressure within a healthy range. This reduces your chances of your body developing further health complications. Blood pressure target is usually below 140 to 90 milligram mercury for people with diabetes, or below 150 to 90 milligram mercury if you are aged 80 years and above. For some people with kidney disease, the target may be below 130 to 80 milligram mercury, but it is always important to speak to your healthcare team about your individual target. While you may not have any symptom of high blood pressure, it can be harmful to your health if left untreated. This is due to the increased pressure it places on your heart, eyes, kidney, and other organs. As we have said previously, heart attack or stroke are some of the conditions your body becomes more vulnerable to with high blood pressure. Other conditions may be kidney disease, cardiovascular disease, cardiovascular dementia, and heart failure. By reducing your blood pressure to healthier levels, you reduce your risk of getting these health conditions. High blood pressure is sometimes called a silent problem or the silent killer, as it usually has no symptoms. Some people with very high blood pressure say they have headaches, but that is rare. So the best way to know is to get it checked. So check it. You can check it at home. You can check it in the hospital. If you have diabetics and high blood pressure, the American Diabetics Association recommends that you self-monitor at home, record the readings, and share them with your doctor. According to the American Diabetics Association, the combination of high blood pressure and type 2 diabetes is not good for you, as it can significantly raise your risk of having a heart attack and stroke. What are the causes or risk factors of high blood pressure? High level of sugar in your blood can lead to something called atherosclerosis. This is when there is a buildup of fatty materials inside your blood vessels, narrowing them. The narrower the blood vessels, the more the pressure builds up. The more stress your blood vessels are under, the harder it is to push blood around the important areas of your body. This means your feet, your eyes, your heart are seriously at risk. There are some other risk factors you can't do much about, such as your age, a family history of high blood pressure, and if your ethnic background is African, Caribbean, or Black African. But there are some risk factors that you do have control over. Those are too much salt in your diet, being overweight, not being active, smoking, drinking too much alcohol, inability to manage your stress well, drinking too much caffeine, such as coffee. If you make changes to your diet and lifestyle, you can reduce your risk of developing high blood pressure. What are some of the effects of high blood pressure on your health? When you have diabetes and high blood pressure, you are at an increased risk of heart attack, stroke, or your kidney problems, because your heart works harder to pump blood through your body. The more your heart is strained, the more it damages your blood vessels. 2, when you have diabetes and high blood pressure, most likely you might have signs of nephropathy, which is kidney disease, or retinopathy that has to do with appear earlier. Diabetic retinopathy may cause blindness. 3, when you have diabetes and high blood pressure, you are at an increased risk of dementia and Alzheimer's disease. This is because the blood vessels in the brain are particularly susceptible to damage due to high blood pressure. This makes it a risk factor for stroke and dementia. When you have gestational diabetes, that is your blood sugar is high during pregnancy, you are at a risk of having high blood pressure. So having diabetes and high blood pressure during pregnancy predisposes you to having preeclampsia, which is diagnosed by the presence of protein in the urine. This is not good for a pregnant woman. So what can be done? Uncontrolled diabetes is not only the health factor that increases risk for high blood pressure. Your chances of having a heart attack or stroke increases exponentially if you have more than one of the following factors. You have a family history of heart diseases. You are eating food that is high in fat, high in sodium. You are living a sedentary lifestyle. Your food is high in cholesterol. You are advanced in age. You are obese and you drink too much alcohol. So how do we prevent high blood pressure for people with diabetes? You need to make lifestyle changes. You need to do daily exercises like walking briskly for 30 to 40 minutes every day. You engage in aerobic activities. This can strengthen your heart and make it healthier. American Heart Association recommends a minimum of either 150 minutes per week of moderate intensity exercise, 75 minutes per week of vigorous exercise, or a combination of moderate and vigorous activity each week. Physical activity can strengthen the heart muscle, reducing arterial stiffness. Exercise also helps you gain better control of your blood sugar level. So you have to eat healthy. What does that mean? You limit sugar in your diet. Eat heart healthy. It means you limit salt. You do away with high fat meats. Do away with whole fat dairy products. Keep to a healthy weight. Be more active. Reduce the salt in your diet. Give up smoking. Drink less alcohol. Learn how to cope with stress and have less caffeine. When you do this and you work with your healthcare team on the type of medication you will take, this will really help you to manage it better. And then if you need a healthy meal plan to help you we offer such. If you like our videos, kindly subscribe, turn on the notification bell so that you get our videos. And under this video, you will get a link for a PDF on how to lose weight and be healthy.